Welcome back, Straight Talkers. With COVID-19 and the lockdown, I've seen more and more children and teens in my clinic with mental health related concerns than ever before. So today, I'm going to discuss the most common mental health diagnoses that I've been seeing and give you some signs and symptoms to watch out for. COVID-19 and the lockdown has caused many significant and sudden changes in our lives and the lives of our children. We all knew we had to make major changes in our routines and day-to-day functioning when this first started. Whether it was not being able to leave home, having to distance ourselves from family or friends, skipping yearly vacations, missing graduations, not being able to participate in sporting activities, and the list goes on and on. However, very few of us expected its effects to last so long. We didn't anticipate this change to become our new normal, and this is hard because humans, especially children and teenagers, thrive off of routine and predictability. While some kids are naturally very resilient and adaptable to change, others are slower to adjust. And some parents who have kids that are struggling with coping have noticed increased anxiety, depression, and behavioral challenges. One study that was conducted in China and published in JAMA Pediatrics examined over 2,300 school-aged children for signs of emotional distress. These children were in lockdown an average of 33.7 days. Yes, only 1 month. And after that single month, 1 out of 3 children reported depressive symptoms, and nearly 1 out of 5 were experiencing anxiety. The CDC also recently came out with a report that discussed how from April through October, the proportion of emergency department visits related to mental health increased 24% for children aged 5 through 11 and 31% for those aged 12 through 17. So many are referring to the mental health effects from COVID as the pandemic blues or as situational depression. However, there's an actual diagnosis that we give in psychiatry to those who struggle with coping through stressful situations, and that diagnosis is an adjustment disorder. So an adjustment disorder is an emotional or a behavioral reaction to an identifiable stressor or a major change in a person's life, right? Symptoms typically begin within 3 months of the start of the stressor, and it causes significant difficulties in one's day-to-day functioning. So I've been seeing a lot of kids and teens who at baseline are great students, but have been struggling with poor concentration and work completion. But it's important to recognize that not all kids and teens respond to stress in the same way. And there's a lot of variability in the signs and symptoms to watch out for. Some kids will struggle with symptoms that mimic depression, so things to keep an eye on would be mood swings, tearfulness, an inability to enjoy hobbies, them pulling away from others, maybe some unhealthy eating or sleeping habits. Other symptoms might be more anxiety-based, and we see excessive worrying, reassurance-seeking behaviors, fears of separation, or your child asking a lot of what-if questions. And then lastly, some kids will struggle with behavioral disturbances, and this might include irritability, outbursts, or them being more defiant or refusing to comply with requests. Younger children might also return to behaviors that they've outgrown, such as bedwetting or thumb sucking, and it's also common for children to complain of having frequent headaches or stomach aches. Adjustment disorders can happen at any age, and they occur equally in males and females, and the length of time an adjustment disorder lasts is often dependent on the stressor, and typically, symptoms last no longer than 6 months after the stressful event is over. If you suspect that your child is starting to struggle from the effects of COVID, early recognition and treatment are key in getting your child back to their baseline and feeling better. Depending on the symptoms, professional treatment might include individual therapy, family therapy, or medications. If you found this information to be helpful, make sure to subscribe so that you can be the first to know when new content comes out. Otherwise, head on over to the next video to find out more ways that you can help your child live their best life.